Dr. Robyn Roberts is a board-certified urologist from Urology Austin. She provides highly effective urology care and compassionate support to help her patients feel better. After completing her urology residency at the University of Texas in Galveston, Dr. Roberts served as an assistant professor at the University of Texas. Dr. Roberts then worked as a physician at Regional Health Rapid City Hospital in South Dakota and private practice at Southland Urology. She brings this wealth of experience to her patients at Urology Austin, and her goal is to provide an accurate diagnosis and customized treatment plan for each patient in her care. We do have a lot of great content to cover tonight. So, Dr. Roberts, I'm going to turn it over to you to get us started.
All right. Well, first of all, I'd like to thank Boston Scientific for helping us present this webinar so that participants can learn about BPH and the treatments we offer from the comfort of their own home. I'd also especially like to thank you, Abraham, for helping me with this and coordinating all the technology. I appreciate that. I also would like to say I'm coming to you live from a small brewery in Wimberley, Texas. Due to several circumstances, I had to move my webinar to my neighbor's small brewery. So thank you to my neighbors. We're gonna go over a few topics tonight, all having to do with the prostate, mainly workup and treatment, and basically so you gain more information to know if you're a good candidate for a prostate procedure and if you're ready to take that step. So we're gonna first cover prostate anatomy, and then we're gonna go over what a benign prostatic hyperplasia is, or an enlarged prostate is, and then all of your treatment options. Okay, Abraham, next. All right, so the prostate is a small gland that sits at the base of the bladder. It's a terribly inconvenient place for a gland to sit because as it grows, it can compress the urethra, which is the tube that you pee through. And compressing that tube can cause a lot of obstructive symptoms. The prostate is really a reproductive organ. So after you're done having kids, it doesn't really serve too much purpose other than to make fluid. It grows to its normal adult size in the 20s and will continue to grow throughout your life. Go ahead and you can go next slide. All right. So in urology, we see men with all sorts of issues with their prostate. There's BPH, also known as enlarged prostate or benign prostatic hyperplasia. Prostatitis can be an infection of the prostate, which can be very painful. And of course, we see prostate cancer. Now, we will not be covering prostate cancer or prostatitis during this talk, but if you have questions about that, I'm happy to talk with you about that in clinic. Go ahead. So, what is BPH or an enlarged prostate? BPH means the prostate gland has grown to larger than normal size. When a prostate does this, it can lead to several symptoms. It can lead to bladder outlet obstruction, which is where the prostate surrounds the base of the bladder and the beginning of the urethra, the tube that you pee out of. And as it enlarges, it compresses that urethra or that tube and can lead to things like urinary frequency, urgency, flow stream, getting up at night to pee often, or difficulty with long car trips or airplane trips. The benign means non-cancerous. Prostate relating to the prostate gland, and hyperplasia means more cells than normal. Okay. Next slide. So BPH, or an enlarged prostate, is not prostate cancer. BPH does not cause prostate cancer. So if you listen to some of these symptoms and you think, okay, well, I have all these symptoms, but I'm really worried about prostate cancer, it's likely not prostate cancer, it's likely an enlarged prostate. But I still encourage annual health screening for men to get their prostate checked to rule out cancer. BPH can have similar symptoms to cancer, which is why it's always so important to keep your annual exam and annual labs done every year. So what we do to screen men for prostate cancer is we do a blood test called a PSA, and we do an exam called a digital rectal exam. Now, PSA levels alone do not distinguish between an enlarged prostate from prostate cancer. Some men with large prostates will have high PSA levels, and that does not mean they have prostate cancer. However, you can have prostate cancer within a large prostate. So the two aren't mutually exclusive. They can happen together, but if you have one, it doesn't mean you have the other. All right, next slide. So as I'd said before, or alluded to before, as you can see from this picture, as the prostate enlarges, it can put pressure on the urethra. And if you look on your screen, you'll see a little green arrow. That green arrow at the top is in the bladder, and it's pointing to the bladder neck, which leads through the prostatic urethra. And then after the prostatic urethra, it goes through the penile urethra and then hopefully into the toilet. And if you look on the right-hand side of the screen, you're going to see what an enlarged prostate looks like. How that arrow is showing you that it's much more difficult for that urine to flow through that tube because the prostate's surrounding the base of the bladder, as well as the urethra compressing that channel. What's interesting about urinary symptoms is sometimes you can have these symptoms but not necessarily have a large prostate, so it can be a misnomer in a way. Sometimes small prostates, just because of the way they're shaped, can cause a lot of these symptoms. So if you have these symptoms but have been told you have a small prostate, that doesn't mean you can't have the procedures or the treatment we're talking about today. Okay, next slide. So if you have these symptoms, you may have an enlarged prostate. So if you frequently urinate during the day or the night, if you have a sudden urge to get to the toilet or can't postpone urinating, if you have burning or painful urination, the feeling that you're not emptying your bladder well, or trouble starting your stream, or even if you start a stream, but then it's intermittent, for example, if it cuts on and off, you may have an enlarged prostate or a prostate compressing the urethra. Some men have symptoms that are so extreme that eventually they cannot pee because they've had so much urethral compression by their prostate, and they end up in the ER in a lot of pain. So if you have these symptoms, it's important to get checked out so you don't end up in the ER in pain. All right, next slide. Here's some statistics that I think are interesting and really eye-opening. So about 12 million men visit their urologist every year with BPH symptoms. And I think this is eye-opening because 95% of men with moderate symptoms are unhappy and don't want to spend the rest of their lives going to the bathroom frequently, having a poor stream, feeling like they're not emptying well. 49% of men experience sexual problems associated with these urinary symptoms. And 51% of men with enlarged prostate or enlarged prostate symptoms say that this aspect of their life, their urinary symptoms, interfere with their normal life, their daily behavior. And if you're a man and you have to share a bathroom with your partner, it may affect your partner's life as well. Because if you're getting up at night to go to the bathroom, waking your partner up, turning on and off the bathroom light, spending more time in the toilet or the restroom and hogging it for yourself, your partner may eventually become upset. So be considerate. Next slide. Okay. So BPH is the most common prostate problem for men 50 years of age and older. And it affects 50% of men by the age of 60 and affects 90% of men by the age of 90 or 85. In 2010, 14 million men in the US had lower urinary tract symptoms, which include the urinary urgency, frequency, weak stream, intermittent stream, and incomplete emptying. There are risk factors that increase your chance of having these symptoms, such as obesity, lack of exercise. Okay, next slide, please. So what happens when you come to my clinic and we evaluate you for these symptoms? So we first have a candid discussion about your symptoms, and we ask you how much these symptoms bother you. What symptoms are you having? And we use a scoring sheet to have objective measurement of how severe your symptoms are. And using that scoring sheet, we have a tally or a score that we report back to you and say, hey, listen, Mr. Smith, you have severe symptoms according to the test you just took. We also will do a physical exam. So if you're asked to undress, that's very normal. So we want to examine the prostate, and it's always a good idea to have a testicular check just to make sure that there's no abnormal masses in the scrotum or testicles as well. We'll do a measurement called a PVR. That's a small ultrasound of your bladder after you pee. And what that does is it measures how much urine is left in your bladder after you feel like you've emptied or after you've gone to the bathroom. For some men, it can be startling. So the average bladder capacity is about 350 cc's. And I'll commonly have patients come in, feel like they've emptied their bladder, and have 100, 250 cc's left over. And so we talk about what happens when you walk around storing urine. Sometimes we'll do assessments of how well you flow. That's called peak urinary flow. We'll have you pee into a special toilet or commode that measures how fast you're able to produce that flow. Okay, next slide. So once we've done with your workup and we've done your exam, we'll oftentimes also draw your blood and do prostate cancer screening. Then we talk about your treatment options. And oftentimes your treatment options are really based on the severity of your symptoms. The first most conservative treatment option is behavioral modification. So that means fluid management, weight loss, healthy diet, and just watching to see how your symptoms develop over time. Most of the time, when a man comes into my clinic, when he's ready to be seen by a urologist, men have already changed the way they drink. Maybe they're restricting their fluids at night so they can get through the night without getting up and going to the bathroom. They may restrict their fluids before car trips or airplane trips. They may not drink a second beer while they're watching the game because they won't end up watching the game. They'll be in the toilet. So most men have already done behavioral modifications, whether or not they're meaning to or not, just to sort of get through daily life. Some men come in and they've already been started on medications by their primary care doctor. So the first line therapies after behavioral modifications are medications. The two most common that you'll hear about are Rapaflow or Flomax. They have generic names as well. And what those medications do is they really relax the prostate tissue to help open the prostate as you pee. Now, those medications can have side effects. Some men, when they initially start taking those medications, can have dizziness or fatigue. There's something called dry ejaculation, also known as retrograde ejaculation. And oftentimes men are not happy with those side effects. Then there's always minimally invasive procedures, which is the topic of today's presentation, namely the Resume water vapor therapy. The reason we love the Resume water vapor therapy is it can be done in clinic without anesthesia, and it can be done on an outpatient basis. And then there's permanent implants. I'm sure everybody has heard of the UroLift, which are these small sutures or tabs that are placed in the prostate and they pull the tissue apart. And then of course, there's surgical treatments where you have the tissue removed, either with a small scope, and that procedure is called a TURP, or GreenLight laser therapy, where the tissue is vaporized, or even a prostatectomy where the prostate's removed with a much larger surgery. Okay, next slide. Okay, so another question that I get asked often is, hey doc, I'm on these supplements. What do you think about these supplements? And the most common one that people come to clinic with is called saw palmetto. So interestingly enough, there are no studies that show supplements will work for symptoms. Now, that being said, there have been studies that show that these supplements work just as well as placebo, and placebo is no medicine at all. So there can be a placebo effect where people think they're getting some sort of therapeutic benefit, but it's not actually happening. So don't waste your money on these supplements. Not only that, but supplements are often not FDA regulated, so you don't actually know the quality that you're getting with these. All right, next slide. Okay, so I've already alluded to this a little bit when we went over our treatment slide, but watchful waiting, what is it? So like we said, this could involve a lifestyle modification, like adjusting your diet, restricting fluids 3 hours before you go to sleep, use of medication like Flomax, Rapaflo, and of course, exercise patterns. So the problem with watchful waiting is, when do you stop that period? Do you want to be on medications for years or months? And remember, every time you buy a medication, that's money out of your pocketbook. And it doesn't really help you because they're just sort of kicking the can down the road. The reason we offer it is because it's really low risk, right? So there's no anesthesia, there's no implants, there's no surgical treatment. However, while you're in this period, there's always a chance your symptoms can worsen. And if you're obstructed, then the bladder's always having to fight against a force. And the bladder is kind of a lazy organ and doesn't want to push very hard, and eventually can become damaged. So if you have chronic bladder outlet obstruction, then your bladder is going to be damaged. The muscle can be replaced by a collagen, and that collagen doesn't have the same contractile properties as the muscle. And so eventually the bladder may lose its ability to contract. So as someone who really believes in early treatment and minimally invasive treatment, I'm not a huge fan of watchful waiting. So I try to get my patients off medications and treated as soon as possible, as long as they're a good candidate. All right, next slide, please. All right, so I think I've jumped ahead of myself a little bit here, so please forgive me. Medications, like we said before, it relaxes the muscles around the bladder neck and the prostatic urethra, and that allows the flow of urine to become a little stronger. And again, no general anesthesia, no implant, no surgical treatment, but a lot of people discontinue their medications because they do not like the side effects, the fatigue, the dizziness. Some people will have fainting spells on these medications, although it's rare, it can happen. And of course, interactions with other medications. The other thing is, as you age, I noticed that we gather medications. And so by the time you're 60 or 70, you're on 7 medications. And my job as a surgeon is to get you treated so that you're not reliant on taking these medications all the time. I love it when I can get people off 2 medications by doing a prostate procedure. Anyways, that's just a little about my style personally. All right, go on to the next slide, please. There's another medication out there you may have heard of, finasteride or dutasteride. Those medications actually stop the growth of the prostate and can even act to shrink the prostate. You have to take that medication for about 6 months to get a 20% reduction in volume. That medication can cause erectile dysfunction, a low libido, ejaculatory dysfunction, meaning problems with ejaculation, and it can even cause breast enlargement. There have been studies that some of these side effects from these 5-alpha reductase inhibitors like finasteride or dutasteride are actually irreversible. So I'm very careful when I prescribe those two medications because I don't want my younger patients who are in their 50s to have these sexual side effects. All right, go ahead to the next slide. All right, so this is my favorite part. So resume water vapor therapy. Let me see if I can get that off there. Okay. So what is it? All right, so it's an outpatient or in-clinic procedure where you do not have to have general anesthesia, but we keep you nice and comfortable. We place a small scope into the urethra, the penile urethra, into the level of the prostate. Through that scope, we place a small instrument. It's like a little pin or a little needle that goes into the prostate and delivers steam or water vapor. That steam kills off those prostate cells, and over time, those cells die, and the prostate shrinks and the channel opens. You do not require general anesthesia. There's no permanent implant, and the surgical retreatment rate at 5 years is 4.4%, which is pretty comparable to our gold standard TURP, which we'll talk about in a minute. The procedure itself is fairly easy. We keep you nice and comfortable during that procedure, and I can talk a little bit more about that later on in this slide or in the presentation. What are the potential side effects? Initially after the procedure, I tell every patient, listen, you're gonna hate me for 2 weeks. There can be urinary urgency, urinary frequency. You may have blood in the urine initially, decreased ejaculatory volume. Because the cells of the prostate, they have to die off over time. You can have initial swelling, and that can cause you to have some obstructive symptoms where it's more difficult initially to empty your bladder. That can cause an urge to pee. Those symptoms usually abate after 2 to 4 weeks. And then you'll start thinking that, you know, hey, Dr. Roberts isn't so bad after all. All right, go ahead, next slide. And here's a little video about how it works. Abraham, do you want to play that?
Resume water vapor therapy is a non-surgical treatment for BPH. Resume uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Resume is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Resume therapy lets you quickly return to normal activities. Talk to your doctor about Resume if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
All right, so that video really did a great job summing it up, and most people are very happy with Resume. As you can see from this information on the slide, 97% of patients would recommend it for a friend. We don't really need to watch Joe, the Resume therapy patient, I don't think. So we can go on to the next slide. Okay, and then prostatic urethral lift. So this is also a minimally invasive procedure that doesn't involve any cutting. It can be done in the clinic. This, instead of reducing the size of the prostate or reducing the tissue mass to reduce the obstruction, this procedure actually implants little tabs into the prostate, and that those tabs pull the prostate tissue aside. And by pulling the prostate tissue aside, creates a larger channel for you to void through or pee through. I initially started doing the prostatic urethral lift or UroLift about 3 or 4 years ago. And while it's a great procedure, the retreatment rate at 5 years is much higher than the resume. So I don't generally perform a lot of prostatic urethral lifts any longer now that we've incorporated resume into our clinical practice. One thing about having an implant is that they can calcify, and those calcifications can cause urinary tract infections. And if they do calcify, then it's easy to remove these tabs, but it does require a procedure in the operating room. Potential side effects of a prostatic urethral lift: painful or frequent urination, blood in the urine, pelvic pain, urinary urgency, feeling like you can't empty initially, but that gets better over time, or painful ejaculation. Now, most of these side effects, they may occur up front, just immediately after the procedure, then abate over time. So this is still a good minimally invasive procedure. I just personally don't like it as much as I like the resume. But every surgeon is going to have their biases. So I always, if people want more information or they want to speak to another surgeon about the prostatic urethral lift and get his or her input, I'm very happy for them to get a second opinion. We get second opinions on our cars, so we may as well get second opinions on our bodies. Okay, next slide, please. Then there's the GreenLight laser therapy. So this is done in the operating room. This also removes prostate tissue to create a more open channel. You do have to have general anesthesia, so it's done in a hospital or an outpatient surgery center. It is not a permanent implant, and the rates of retreatment or the need for another surgery are nice and low, just like the resume or a TURP. This procedure destroys tissue by using a GreenLight laser to vaporize the tissue. Potential side effects include erectile dysfunction, maybe a dry orgasm where you can climax, you can reach orgasm, but you're not going to be ejaculating. That's called a dry orgasm. You could potentially have some bleeding after this. Like with any procedure, it usually clears up over time. But this is also a great procedure. I wouldn't consider it minimally invasive just because it does need general anesthesia. Okay, next slide. This is a video about how GreenLight laser works. I'll just talk through it real quick. So you go into the operating room, you're placed under general anesthesia, so you don't feel anything, you don't remember anything. A scope is placed into the bladder, and a small laser, aptly named GreenLight because it emits a green light, is focused on the adenomatous tissue or the enlarged prostate tissue, and that GreenLight just vaporizes the tissue in front of it, and at the end, you're discharged home. You're woken up from anesthesia and then discharged home with a catheter for a couple of days. I don't do a lot of these, and so if you're interested in this procedure, there are people at Urology Austin who do offer this. Okay, next slide. All right. So outside of resume, this is my favorite procedure for an enlarged prostate. So a transurethral resection of the prostate is really the gold standard by which we measure any other prostate procedure by. It's an outpatient procedure done under general anesthesia in the operating room. You do not need an implant. So what we do is we place a scope into the urethra, and we visualize the bladder and the urethra, and through that scope has a small loop on it, and that loop runs a heated wire or a current. And with that, we resect or cut the prostate so that we remove chips of that prostate and we make a larger channel for you to pee through. Now that heated wire, or that is also cauterizing or fulgurating or burning the prostate bed so that there's minimal chance of having any significant bleeding afterwards. You do go home with a catheter. I usually keep that catheter in for a day or two, and then you come back to clinic and we take that catheter out. People who have this procedure, they notice a much better stream immediately. Like as soon as I take that catheter out, they say, you know, Dr. Roberts, I haven't peed like this since I was 20, or you're not going to believe this, but I hit the back of the toilet seat. So people are very excited about the strength of their stream after this procedure. Whereas the more minimally invasive procedures like the Resume, they take a few weeks to get to the same place. Okay, we can go on to the next slide. Okay, and then there's a prostatectomy. For an enlarged prostate, the prostatectomy that we do is called a suprapubic prostatectomy. It's not the same kind of prostate removal that you would have if you had prostate cancer. Suprapubic prostatectomy is now done robotically or laparoscopically, where the bladder is usually opened and the prostate is cored out from the inside of the bladder. There's a larger risk of bleeding, and it's a much larger surgery, a little bit more difficult to recover from. You're probably going to end up wearing your catheter for much longer than just a couple of days. And of course, because you're removing most of that prostate tissue, the surgical retreatment rate at 5 years is 2.7, which is the lowest of all the procedures. Okay, next slide. Insurance coverage. So this is a very common question, and I do not blame patients for asking, because the last thing you want to do is recover from surgery and then get hit with a bill that you were not expecting. The good news is Urology Austin has an incredible department that calls your insurance company and gets prior authorization from your insurance company for any of the procedures that we offer. They will often then call you and say, hey, listen, Mr. Smith, you haven't met your deductible, so it's going to be X amount of dollars. That being said, I really highly encourage every patient to call their insurance provider to verify that what we've done is correct. And, you know, we do really emphasize that ultimately it's the patient's responsibility to know your insurance coverage, although I don't really think that is always feasible. I don't know my insurance coverage and I'm a doctor. So don't feel badly about that. We walk you through that process. And I want to give a shout out to my surgery scheduler, Alexis Nandon. She does an excellent job with communicating with patients. I could not do the surgeries that I do without her. So big shout out to the people in the back office really working their tails off for our patients. Okay, next slide. In summary, the prostate's this gland that's fairly useless after you have all the children you want to have. It enlarges and causes a lot of urinary symptoms in men. Sometimes it doesn't even have to be that large to cause symptoms in men. You can watch these symptoms, but be cognizant that while you're watching these symptoms, your bladder may be becoming damaged over time. First line therapies, there are medications that potentially have side effects. I'm not against medications. I just personally try to get my patients off of medications. There's minimally invasive procedures that can be done as an outpatient, where the recovery time is a few days, although you're going to have symptoms during that recovery period for up to 4 weeks. So we have the Resume and, of course, the prostatic urethral lift. And then there's more invasive surgical procedures, my favorite being the TURP. Okay, so what's next, Abraham? So if you have questions or you want to come see me in clinic and talk about these options, I'd be happy to see you. I'd love to see you in clinic, and we can talk more about your specific needs, your symptoms, and your lifestyle, and see how these treatments incorporate into who you are as a person, your value, and what you want as an outcome. Next slide. print.